Hi, my name is Steve Jones. I'm a physician at Greenwich Hospital, which is part of the Yale New Haven healthcare system. I want to share with you a little bit about my experience with Just Culture. So about 5 years ago, my risk manager came into my office and handed me an article written by David Marks about Just Culture. And when I read it, it really did begin to capture my interest in terms of some of the things we were struggling with in terms of our safety issues at our hospital. We felt we had an extremely good organization, a safe organization, high reliability organization, but we knew we were not seeing or hearing about all the events that we could hear about, and we wanted to do what we could to certainly raise the bar for ourselves in terms of that aspect. So I remember bringing this Just Culture model to our leadership and talking to them about the possibility of bringing it to the hospital. And there was a lot of good comments made about it, but there was some skepticism as well. And some of it was, we're doing very well right now. Why do we need to even introduce something that may change our culture in the wrong way? The kind of thought I have is almost like when you're in an Olympic race, the difference between first and second place is not very much. What's the thing that gives you that edge that makes you even better? So I think, bringing in something like the Just Culture model is going to push you to that next level. The other argument was that people felt that, this looked in some aspects on a very superficial level without knowing it well, like it was kind of letting people off the hook. This human error thing that we're allowing mistakes and we're forgiving people for mistakes. And when you get to know the Just Culture model, you realize that that's not true. This is a model of elevated accountability. This is true accountability where we don't excuse the mistake, but we understand it. We don't say the at-risk behavior is okay. We coach that and we help people to get to that right place. And so when it's used right, it really does make a difference. And for me, I saw this as a game changer. So to make a long story short, we decided to bring the Just Culture people into our organization, and we arranged for them to come and do several days of training for our managers and directors. And it was received very, very well. The feedback we got was, and I remember saying this to John Westphal, who came and did the presentation. It was the first time I had ever seen every evaluation come back with all fives. Everyone was thrilled with their presentation. And we felt good about it, and I felt, boy, this is really going to change things. And what we noticed was that although people loved this, we really didn't see too much change at first. It was kind of where we had always been. We were kind of operating in the same modality. I remember calling John up and saying, this is great, but I just don't see really how we're changing. And John said, patience. You change the culture sometimes slowly and sometimes one person at a time. And that is so very true. It really is an evolution. We brought John back for a second trip. I went in and did Just Culture certification with David Marks, which was very, very helpful for me in terms of bringing the model back to my organization and again, re-emphasizing it. So let me tell you kind of what the outcome is in terms of what the impact has been, because it is something that, you have to step back and see the change over a period of time. And now with maybe 5 or 6 years now having evolved, I can begin to see the arc of change. And for us, like many other hospitals, we're not looking to change our culture as much as enhance our culture and make it a richer place. Like the Olympic athlete going into that first place aspect of winning, if you will. So one of the things we did was, when we looked at our data, we participated in something called the ARC survey, which many hospitals do. It's a benchmarking survey by the Agency for Healthcare Research and Quality. And when we looked at our scores, one of the areas we saw where we were weak in terms of people perceiving safety in our organization was among our physicians, particularly our house staff. And so we decided to go in there and really introduce the Just Culture model to them and get them involved in this in a meaningful way. And we had them organize their own internal group, so if they didn't feel comfortable reporting, they could report to each other and discuss it, and what they wanted to bring to the rest of the organization, they could do it at what they felt was the appropriate time. And when they did this, we found that it started picking up momentum. We heard the house staff and the doctors using the Just Culture terminology, talking about at-risk behavior and modeling. And the way we could benchmark this is when we did our survey the first time and versus the next time after we introduced this Just Culture model, we saw a 25% increase in terms of positive scores for our ARC survey, which was very, very significant. And they've introduced this into the lingo of their everyday conversation. The other thing I can tell you is we now, at every orientation, for every new employee, introduce Just Culture right off the bat. Our CEO comes in, welcomes them, introduces me, and we start talking about Just Culture right off the bat, human errors, at-risk behavior. And we talk to them about the fact that you are going to make mistakes. And we say, you may be the best people in the world, you're well-intentioned, it's why we hired you, but you're going to make mistakes. And I get some confused looks sometimes, like, how can you be saying this to us? But what we want them to hear is that this is the way it is in the real world, and this is the expectation they should have for themselves. What we want them to do is take those mistakes and share them with us and make it a true learning environment. We say the only way to get in trouble is by covering those mistakes up and not really revealing them and talking about them. The other thing that we've started to do, which is very, very powerful, is we speak about every serious safety event in front of all of our leadership. We go in detail. And I'll share with you a story which to me really captured the fact that we had hit that tipping point, if you will, in our organization where this was really making a difference. We had a relatively serious safety event occur in our emergency room with one of our nurses. And we brought the head nurse from the emergency room to the leadership to speak about this incident with our risk manager and other players involved. And we spoke very openly about it. We broke it down, talked about the root cause analysis and how we were going to manage this. And it was a very good conversation. But what was telltale was at the very end, when we were done, the nurse who presented this serious safety event, who is a seasoned nurse, has been around for a long time, said, I just want to say one more thing. She says, I am just so proud of this organization that we can speak so openly about this and feel comfortable about doing it and share this in a way that is going to make a difference. She said, in my past, other places I've worked and in my training, I've never felt this way. And she said, I'm so proud of where we are right now. At that moment, I wanted to get up and hug her. And it was followed by a round of applause. Those are the types of things that really define the power of Just Culture. And I can't say that it's the end all and be all in terms of making a difference, but it does make a difference. It is a game changer. And when you integrate it into the other good things that we need to do in organizations for quality and safety, it makes a lot of sense. So for me and for our organization, we've had nothing but good success with this. It's certainly a journey. For me, there's no real finish line. It's about trying to get further and further down the road. But I think the more we really embrace these qualities of Just Culture in a real way and model it and are sincere about it, the more it's going to make a difference. And to go back to what John Westfall said to me, which had so much meaning, is sometimes you just do this one person at a time. And for us, we have this now self-propelling type of operation where people are getting more and more engaged in Just Culture and safety. And at the end of the day, it's about saving lives. And I have no doubt that what we have done by introducing this into our organization has saved lives. So thumbs up to David Marks and Outcome Ingenuity for all this, and that's my story.